Hello, I'm Dr. Phillips. I'm a GP partner in our Wisley Medical Practice here in Llanidloes. You've been directed to this link as you've expressed a desire to undergo a vasectomy. This video will explain the process and procedure, as well as considerations to think about before signing the consent form. Once the consent form is completed and returned, a consultation can be scheduled with myself to answer more personal or detailed questions you may have, and we can also organise a suitable time to book in for the procedure during that consultation. This service offers vasectomies under local anaesthetic only, with a no scalpel technique. The following animation will give you more details regarding the procedure itself.
Vasectomy is the most effective form of permanent contraception, being simpler, safer, and 10 times more effective than female sterilisation, with a failure rate of around 0.05%. There is no effect on sexual function or desire as a result of surgery. However, you need to consider that the procedure cannot always be reversed and that reversal is not available on the NHS. You must therefore be sure that your family is complete before having a vasectomy. It's best to have a frank and open conversation with your partner regarding this, and their involvement is welcomed in the consent process. It is also not an instant form of contraception, and hence you will be required to continue an alternative, reliable form of contraception for at least 16 weeks post-procedure until a semen sample can prove the operation a success. How is it done? After letting a local anaesthetic take effect, the 2 tubes, vas deferens, which carry sperm from the testes, are accessed through a stretched opening in the scrotal skin. These are then cut, cauterized, and the 2 ends kept separate by an absorbable stitch. The result is that a man's ejaculate will appear the same in every way but not carry any sperm, and therefore be unable to fertilize a woman's egg. On the day. Having booked the date, you will be issued with 10 mg of diazepam to be taken 1 hour before the procedure. This means you are not legally able to drive and will need transport to and from the surgery. Dr. Phillips and a nurse will be present for the procedure, which is variable in duration, but generally around 30 minutes. After the procedure is finished, you will have a pad over the operating site that needs to be held in place with tight-fitting underwear. The pad needs to stay until the following morning, when you can remove it and shower again. It's sensible to keep the tight underwear for 1 week to offer scrotal support. Post-operatively. Details and forms for submitting a semen sample 16 weeks later will be given to you before leaving, but it's imperative that alternative contraception is continued until you have a letter in hand stating you can stop. You are advised to take 3 days off work, with the aim to do as little as possible in that time. The less active you are in the first 3 days, the less potential there is for complications. Complications are rare but include 1. Bleeding causing bruising or a blood collection in around 1 in 200 cases. 2. Infection requiring antibiotics. 3. Failure by rejoining of the vas deferens resulting in fertility and potential pregnancy in around 1 in 2,000 cases. 4. Chronic testicular pain for a few months in around 1 in 20 cases, or persistent, very rare. 5. Formation of a sperm granuloma. Innocent but palpable pea-sized lump in the scrotum, seen in less than 1 in 100 cases.
I hope you found that animation useful, and if you're happy with the explanation given and the considerations discussed here, please sign and return the consent form and call to book your remote consultation. However, if you do not feel a vasectomy is right for you at this stage, please return to your regular GP to discuss alternative contraceptive options. Many thanks for listening, and we hope to see you soon.